welcome to the Stat Dose podcast, where today we're going to be discussing top tips for starting F1.
My top tip number 1 is ask questions. Ask questions when you don't know, ask questions when you think you do know, ask questions. No one expects you to know everything, so it really is fine. Try not to be embarrassed. Sometimes it is embarrassing when you're asking questions and you feel like you should know, but you'll never get in trouble for asking something that helps keep patients safe. There's TLAs all over the place. That's 3-letter acronyms to you guys.
I'm so glad you said that, Jamie.
If you don't know what this TLA stands for, then ask, clarify. If you're on the ward round and someone says, refer to X for this, or can we just get a CT, whatever, and you're like, don't know why we're doing that, then ask them, because it'll be much easier to get the thing to happen if you know why we're doing it. The patient may well need it because the consultant thinks they need it, or it will prompt the consultant to think, actually something else might be more appropriate.
I think a lot of F1s don't ask questions because there's this fear of looking stupid. Let me assure you, your seniors want you to do right by their patient, essentially. And if you don't ask questions, you end up missing stuff. And it's much more frustrating for the senior to come back later on or the next day and have things that they wanted done the day before not completed because you didn't understand why you're doing them. So actually asking questions, again, is about patient safety as well as your own learning. I will go with number 2. I think using your team. So remember, you're part of a team. Get to know people. So there's lots of different job roles on the wards or wherever you're working, particularly get to know the other doctors. So hopefully you'll have some sort of induction process. You might know some of the F1s around you, but they might not be the ones that you're working with on the ward. So get to know your F2s, your registrars, your consultants, particularly know their skill sets as well and who you're going to call, how you're going to call them, but also get to know the nurses, the pharmacists, the HCAs, all these sort of people who actually spend probably more time with your patient than you do. And again, also everybody else, such as the phlebotomists, the doctor's assistants, the physician's associates, ward clerks, all of these people are really helpful. And if you at least have introduced yourself and been polite and kind and, a smiley face or a smiley face behind a mask, it makes your job easier ultimately if you know who you're talking to. Because actually the ward clerks are huge fonts of knowledge for various things about how the hospital runs that you probably don't know. And also remember that actually people talk. So a lot of the nurses will talk to other nurses on different wards. And you don't want to get a reputation for being rude, grumpy, unpleasant, difficult to work with.
Top tip number 3, speak up. Often on a ward, your knowledge is the most up-to-date of the patient, compared to a consultant who you might have a different consultant on that ward every day of the week who's doing the ward round, whereas you've known your patient for the past 2 weeks that they've been admitted, and actually you'll sometimes have a better understanding of what they've been going through, what has happened in kind of their admission, and what their main concerns and kind of worries are. If your consultant or senior or someone else starts doing something that you think, actually, I'm not too sure that the patient wants this, or we've already tried this previously, don't be afraid to speak up and just kind of use your graded assertiveness. So your PACE, which is probe, alert, challenge and escalate. Because if you can spot something going wrong early, or something that's likely to be a waste of time, as I say, if you notice that actually someone's already had this scan, that could be a waste of time for the patient and for the rest of your team. So don't be afraid to speak up and kind of just prevent those kind of serious consequences as well as kind of that waste of time. If you feel like there's things that are consistently going wrong kind of within your team and your ward, which sometimes, occasionally does happen within the NHS, that you just feel that for some reason or another it's not working and there's repeated errors being made and patient safety might even be being compromised, then you can speak up to other people outside of your team. So people like your clinical supervisor, speak up guardians in hospitals, and they're a great person to talk to, or even escalating, above your consultant and to different consultants, and just, feel like if you don't feel you can raise those issues within your team, then making sure you're relating them to someone else.
Because the F1s and F2s are rotating a lot, and sometimes they're rotating for different hospitals, it doesn't necessarily have to be a patient issue, but actually if you've seen something done on a ward that's been more efficient, then actually there's probably a little QI project in there somewhere, and nobody's going to be anti you bringing in something that's going to make the ward work smoother. So actually if you see a problem that you think, actually on this ward they did this thing and it worked really well, mention it.
I think the other key thing, you've just been perfectly taught how to do all your clinical skills, whereas everyone who's on the wards has picked up bad habits, and so actually you might know how to do a thing with more up-to-date evidence-based practice.
Yeah, and guidelines are changing all the time as well, so we try and keep you up to date, and doctors in the profession will try and keep up to date, but if it's been a long time since you've done something, then they might not realise that the evidence has changed.
Top tip number 4, The brackets electronic question mark twat box or twat pack.
Why is it electronic in brackets?
I'm glad you asked that, Matt. So, back in my day...
Your day was like a year ago.
2 years ago, everything was all paper still, like referrals, some imaging, and so you'd need often on the ward round to fill in some piece of paper in order to get whatever the consultant wanted from the ward round to happen. It can be convenient to have a pack of all of the paper stuff that you need in terms of forms to fill in, as well as continuation sheets, other forms that you use sort of regularly, could be TEP forms, anything else, as well as pens, your handover list, a snack, all the essentials that you're going to need to get through the ward round or whatever part of your day you're in. Even if your systems are all electronic, I'd have my mental electronic brackets, twat box, where I am ensuring that when I get into work, I log into the thing that's got the list, the thing that's got the bloods, the thing that's got the obs, and I've got everything ready, good to go, so that I can access all the information I need.
I think that's such a good tip, Toby, actually going in a bit early on your first day. Chances are you're not going to be able to log on when you arrive on your first day. Every single job that I've rotated onto, I've been blocked from the system, and actually going in half an hour early and being able to call IT before the ward round starts and getting set up makes such a big difference. So I'd say every time you rotate, just on your first day, get there half an hour early and just check that everything works as you expect.
Number 5, use of phone. So, again, back in my day, Toby, which was a few years before your day, use of mobile phones was very much frowned upon. Patients didn't like it, staff didn't like it, looked like you weren't really paying attention, it looked like you were probably on Facebook or gaming or something like that. But now they're quite...
back then?
MySpace, thank you. But now it's very common, and actually a lot of the OBS are taken on iPhones or iPads or something like that. So I think patients are much more used to us using technology, and it's really helpful. So there's loads of useful apps that we can use. So there's iResus, which is the one I always advocate. It's one I use the most. It's got all of your resus algorithms on it. Talkspace is helpful again for me particularly. MD Calc gets used a lot. So you've got all your scoring systems in there. Don't commit any scoring systems to memory ever. There's no point. They're all on MD Calc, and MD Calc is free. Nice guidelines. There's apps for that. Often a lot of your trusts will have their own local guideline apps. Some of them won't, but a lot of them will. Antibiotic prescribing apps, so MicroGuide or Bugbuster are the two big ones that we use in the UK. There's hundreds of apps. BNF is the one that I haven't particularly mentioned.
And the BNF app, it also includes the BNFC, so if you have a children's, a paediatrics job, then you've got the BNF children as well. I also really like Pocket Doctor. I use that a lot in F1, just for your out of hours assessments and plans for common reviews of sick patients. It's not a free one, Pocket Doctor, but I think it's only about £2.
Your phone is also a phone, and just using WhatsApp to have a group of your F1 pals or the team that you're in today or whatever is useful. The induction app is really good for having like extensions and bleeps and stuff for other teams and departments as well.
Top tip number 6. Documentation. So keep clear records. I mean, this might sound like an obvious one, but just be really organised with the way that you're writing your notes. So most of the kind of entries will end with a diagnosis, which is your impression of what the diagnosis is at that point, and a plan. And that just really helps you kind of organise your thinking and help other people understand what you were thinking when you make that plan as well. Remember that kind of all the different team members will be reading through your notes as well. If you're using acronyms, then make sure that you explain what that acronym is, or just avoid it and write it out in full. If you have a clear plan written down at the end, then you'll have fewer interruptions in your day of people coming at you to say, what's the plan? I wasn't quite sure. Or, what's happening next? So, just making sure that you're really clear and organised. It helps you, but also helps the rest of the team as well.
I'd also add legible, because then again, people reading them will not come to you and say, what's the plan?
Absolutely. Unless you don't know how to spell something, and then just do a squiggle.
or somebody's name.
Yeah. That's a name.
Brackets. That's very consultant.
Lovely doctor, whom I don't know the name of.
Fantastic time.
Yeah.
Then top tip number 7 is your F1 portfolio.
Yay!
So I would find out at the beginning of your rotation how many KEXs, CBDs, DOPSs, other workplace-based assessments, procedural skills you need to get signed off. I would start doing them early on in your rotation, maybe not like the first week when you're just trying to find your feet, but I'd try to get more than half done by halfway through. And I'd also start trying to link your evidence. So you have to, once you've done your workplace-based assessments, You need to use those to prove that you are meeting the foundation capability requirements. So I'd start linking those reasonably early on. It's useful for A, showing that you're engaging in the process, and also B, knowing what to target for the workplace-based assessments you do next rotation and third rotation.
The third rotation is one of the key ones as well, because your ARCP date, which is the date that you essentially get F1 or F2 ticked off, often is around June time. So actually you have less time in that third rotation. Yeah. So you don't want to be running around like a headless chicken in those last 2 months trying to get every little thing signed off. So Toby's absolutely right. Try and keep up to date. Make sure your first and second rotations have all been sort of fully signed off.
Yeah, with that as well, getting in your clinical supervisor and educational supervisor meetings booked in early. You might have some supervisors who, are really keen and be very proactive, but often you might have to chase them and just remind them that coming to the end of your rotation, you need to have this meeting signed off for part of your portfolio.
Okay, tip number 8 then. Just be nice. Be lovely. It's easier said than done for some people. I'm looking at myself. Common courtesy is one of the key things, actually. So it's about, again, I've mentioned it before, but introducing yourself, being nice to staff members, but also patients, relatives. Try and remember people's names. That's made a lot easier by the visible name tags that we have. So there's the Hello, My Name Is campaign, which has essentially your name is a lot bigger. It's in a bigger font. It's all it is, but it's a really simple, effective way of people being able to identify you. Making sure your communication skills are up there, making sure you're establishing rapport with staff members and with patients. And actually, when things go wrong, because they will do in practice, that's just the nature of the job. Make sure you apologise, that you're honest and you're sincere, and it keeps that trust and that confidence that's important to patient care. Shouting at people, belittling them, these things, even when it's 2 a.m. and you're getting bleeped about something stupid, that doesn't help anybody. Negativity breeds more negativity. So actually try and stay positive throughout your career as best you can.
Apologising is not an admission of guilt. You're not going to end up in the front of the coroner more for saying sorry. In fact, you'll end up in front of the hospital complaints tribunal less for apologising because you've managed to resolve whatever lingering ill feeling the relatives or patient have there and then.
Top tip number 9, be legal. Don't do things that are against the law in life or in your professional career. So the easy things that you can kind of trip upon with regards to legal things are capacity and consent. Just kind of make sure you know how to document legally if someone does or doesn't have capacity and how to make that capacity assessment. And for consent, so particularly if you've got a surgical job, you might be asked at some point if you start becoming more familiar with the procedures that go on the ward to consent patients. And as an F1, as anyone, you should only be consenting what you are familiar with and what you know the risks and the benefits really well. And so it's worth thinking about actually, am I in a safe position to consent this patient for theatre, or should I pass this on to one of my seniors?
Confidentiality is another thing that's easy to trip up on, so try not to.
We're speaking about kind of the WhatsApp groups where you might be discussing kind of patient data, and it is common to discuss, I've got a patient with XYZ, I'd like to request this for them, how do I do it? But just making sure you're not using any identifiable data for that.
Top tip number 10, the toppest of the top tips is, thank you, take care of you. Because few other people will, really. When your well-being is supported and is looked after, it positively impacts patient care. We're here to look after patients and keep patients safe. The best way we can do that is make sure we're well to do that. Take your breaks, drink water, eat lunch, wear sensible clothes. I'd just encourage you to have a think about your own personality. You know yourself better than anyone. You can vaguely try to anticipate the kinds of challenges that might crop up in F1 stuff. So your challenge is going to be a run of night shifts. Not getting enough sleep is going to make me irritable and frustrated and angry. Then try to work out what makes you less those things in that situation. So having a caffeinated drink. Then also think about how you're going to try to maintain your well-being and not get to the point where your poor sleep means that you're irritated. And so for me, that's like getting blackout blinds and earplugs, eye masks, that kind of stuff. You can have a look on wellbeingandcoping.net. They've got a really handy My Wellbeing Plan where you can think up some 30-second, 3-minute and 30-minute rescue plans.
So those were our top 10 tips for surviving as an F1. Hopefully you found it helpful. And from all of us here, good luck with F1 and the rest of your careers.